I have a news flash. This is something that just happened yesterday. Representatives from the state of California have just finished a survey that they conducted of consumer programs throughout the state. And yesterday, they have released their finding that they have concluded that Jennifer, in concert with the most excellent Bruce Copley, have developed the best consumer program in the state of California. So Jennifer, we thank you, we congratulate you, and I have to also add that that is an amazing Tiffany key that you have around your neck. So given all of that, Jennifer Jones.
Hi. Wow, I didn't know about the state. That's really exciting. I'm really thrilled to be up here. I'm so thrilled I have to make sure I don't get high from it. But I just want to thank my family, my dad, especially my mom, who has been very supportive. And she's coached me and mentored me. I also want to thank my friends, Adrienne and Gary, for being here today and being supportive. I also, this is kind of funny, but I want to thank Samantha, my cat, who couldn't be here today. She's been very supportive also. I also want to thank all the clinicians that have helped me along the way, and the therapists and psychiatrists and doctors. They've been very helpful. I'm really glad Allison Brenner's here today, the MHAP director. She actually helped launch my career. We had this, I always remind her of this, but we had this very animated talk about whether I should come out as a consumer, and I was really against it, and I argued very well, and she's a lawyer, so I'm very proud of that. And I slept on it, and the next day I decided to come out as a consumer, and it did launch. I wouldn't be here today if that didn't happen. I also want to thank, I'm glad Kathy's here today, Kathy Ford from NAMI. Since I started at Zephyr, she helped me with, she's very, very supportive and very kind over, it's been almost 7 years now. And John Mitchum, well, I'm thanking NAMI people. John Mitchum has been very kind to me also, and I really appreciate, I don't know where he is, I really appreciate his advocacy, and I wish him congratulations while I'm up here. There you are, there you go. I also, while I'm up here, the Momentum, Jerry McCann was really helpful for me when I went through vocational services. I actually was kind of a hard client because I was very ambitious. Paul Taylor has also been very kind to me and supportive, and I think I've known him for almost 7 years also. And he was a guest speaker at my San Jose State graduate Human Services Management class, and he made a big hit. So it was a very small class, but it was really nice of him to do that 3 years ago. And I want to thank all the people, my colleagues, the fellow staff, fellow managers, fellow employees throughout the mental health system, and especially the mental health department. I want to thank Dean Wiley for your support, and Nancy Pena. And last but certainly not least, I really want to thank my boss, Bruce Copley. You've been a great support, and you've been my inspiration. Thank you so much.
Careful, Jennifer. Be careful. Be careful. Great. The Shining Stars Nonprofit Award is given this year to the National Alliance on Mental Illness, NAMI, of Santa Clara County, whose president is Kathy Ford. Under her leadership, the Santa Clara County NAMI, hundreds of volunteers provide education and support for individuals living with mental illness and their families. Our chapter here in Santa Clara County includes the NAMI program called Stigma Busters, which is a network of dedicated advocates to fight the stigma of mental illness. NAMI of Santa Clara County is everywhere and all things to the mentally ill and their families. Momentum thanks you big time. Kathy Forward, is she here for NAMI? Great.
Well, this is a big surprise because John was supposed to be up here, so I don't really have a speech. It reminds me of the time that Nava Stopman got me to go to a talk, and I was supposed to talk about the MHSA, and I found out when I got there I was debating somebody from the Church of Scientology. Fortunately, Nava was out of the country for her. And the audience turned out to be very well educated, so they took him on. But anyways, this award, John has been the leader of NAMI for the past 4 years, and Nava before that, and Sharon Roth. And all the volunteers, all the hard workers we have, I think many of you know them, and we're dedicated to fighting stigma and eradicating it through our programs, our education programs, and all of our support groups, and all of you here. So thank you on behalf of NAMI and John Mitchum, our immediate past president. He's supposed to be up here. Thank you.
And actually, John, come up. Come up. Absolutely. We want to recognize you for all of your work.
I have a very long speech here that I had prepared. Really speaking for our NAMI volunteers, this is a wonderful award. NAMI Santa Clara County is almost exclusively a volunteer organization, and we clock around 20,000 hours of volunteer time each year in support, education, and advocacy for those with a mental illness. Our individual members are almost exclusively either mental health clients or consumers and family members. But we also want to thank all of the staff and volunteers and supporters of Momentum. We want to thank the Law Foundation, my good friend Jennifer Jones, and all in attendance as we work together to make a life in the community for everybody. Thank you.
The Shining Stars Corporate Award is presented to the Law Foundation of Silicon Valley's Mental Health Advocacy Project, who give lawyers a good name. The Mental Health Advocacy Project is but one of the amazing programs of the Law Foundation, run by Jim Bauer. Where are you? Bauer's right there. And it provides legal assistance to ensure that the legal rights of those with mental disabilities are protected. Thank you to the Law Foundation of Silicon Valley. Thank you to the Mental Health Advocacy Project for positively impacting the lives of people in this country living with mental illness. Allison Brunner is the directing attorney for the Mental Health Advocacy Project. She's an extraordinary lawyer, and she will accept the award. Allison.
Well, it's just a true honor, Momentum, Paul, and everyone here today to accept this on behalf of Mental Health Advocacy Project and all the programs at the Law Foundation. And I think that what it really represents is a celebration of a great partnership. As Paul said, we can't use our expertise to do our good works to help the community and the consumers without a great partnership that we have with Momentum. And it's incredible to work with an organization that shares our core values and our goals of treating clients with dignity and respect and working hard to ensure that our clients live satisfying, stable, and thriving lives. and it's a real pleasure to be here. And I just have to give a real shout out. There's so many people here to thank, but the real shout out should go to the staff, and I appreciate Judge Cordell, and I have to call you Judge because you were a judge when I first became a lawyer. I appreciate Judge Cordell for highlighting all of the Momentum staff members here, because as all of us know, behind the corporation or the organization are the people that stand and make it happen every day. And I want to just thank all of the Momentum staff, past and present, and also the Mental Health Advocacy Project staff who are here with us today, and the many in the past. We've formed great partnerships and friendships to make our community stronger, and thank you very much for this honor. Thank you.
I want you all to take a good look at Allison as she walks down here. This woman 6 months ago gave birth to twins. Doesn't she look great? Fantastic. What do Congressman Patrick Kennedy, former First Lady Rosalind Carter, NPR, CBS, CNN, Fox, ABC, and Eli Lilly, and Momentum all have in common? Lizzie Smith. She's known some of them, she's been seen on some of them, and she's received awards from some of them. Her amazing journey from theatrical producer to this nation's leading advocate for people with mental illness is captured in her 2002 book, Detour, My Bipolar Road Trip in 4D. And lucky for us, her road trip has brought her here. Please give a momentum welcome to Lizzie Smith, our 2010 guest speaker.
Thank you so much for your introduction, and thank you all for being here today. Thank you for bringing me here to this wonderful event. It really is, it's more than a pleasure. It's deeply gratifying to be a witness to a community where people really care about each other and are being given awards for work that is so near and dear to my heart. I work as a writer and a writing teacher, but my passion is mental health advocacy. When Detour was published in 2002, I started getting invited to speak in different parts of the country, and I consider the opportunity to be a privilege. Although not all of the opportunities are as nice as this one, I think the weirdest opportunity that I ever had to speak was when I was asked to open for the opening day of the Cleveland hockey team. Because as all of you know, hockey and wellness have, they're just like peanut butter and jelly. Completely belong together. So I thought this was so funny. I remember bragging to my friends, oh, I'm going to go open for the hockey team. I'm going to go speak at a rink. Ha, ha, ha. Isn't that funny? Ha, ha. And then, of course, the day of the event comes, and I realize, oh, my goodness, nobody has come to hear me speak. They've come for hockey. I'm going to be on a rink. They have pucks. I better figure something out quick to say. And so I want to share with you what I told the hockey fans, because I think it's germane to the reason why we're all here today, which is how do we reach people about mental health, and how do we connect people who feel divided. So what I told the hockey fans is that when you're diagnosed with a serious mental illness, like bipolar disorder, which is what I live with, it's a bit like being the goalie in a very important game, and you're in charge of protecting the goaltend behind you. But instead of there being one team of players charging across the ice trying to score against you, there's 3 teams. And the first team, which is the illness itself, and this is a knowledgeable crowd. I probably don't need to tell you that if you live with bipolar disorder, particularly if you haven't been able to get treatment for it, it can be an incredibly harrowing, destructive illness that can take away all the things that are meaningful to you in your life. And as if that wasn't enough to have that charging against you, trying to score against you, there's a second team on the ice, and that's the mental health care system, which in most parts of the country, or many parts of the country, is really disabled. And as if that wasn't enough, if it wasn't hard enough to just find the help that you need, there's this third team on the ice charging against our goaltender. And that third team is stigma. And stigma is a word that people use an awful lot. We throw it around. It's it's an important issue, even though things are so much better today than they were 15 years ago when I was diagnosed. It's as important to discuss now as ever. Certainly, we see negative portrayals in Hollywood all the time where people with mental illness are portrayed as monsters. In the newspaper, they did a media study where it showed that 85% of the time that bipolar disorder was mentioned in the newspaper, it was in association with a violent crime, when in fact people with bipolar disorder are no more likely to commit violence than any other group of people. So we have this goalie. He's got these 3 teams charging down the ice trying to score against him. What does he need from us, hockey fans? What does he need from us? Does he need our judgment of him? Absolutely not. Does he need our fear of him? Absolutely not. What he needs is our empathy for what he's going through and our respect for all that he has on his plate. And I think it's a message that the hockey fans could hear. I think it's a message that people can hear in general. My story started probably at birth. There are people with mental illness in my family. My grandfather was a orthopedic surgeon who had bipolar disorder, but he couldn't tell anybody about it because who would want, an orthopedic surgeon with bipolar disorder? So he kept it a secret. When I was growing up, I had bouts of depression and what was probably mania, but really only about 10-15% of the time. I grew up in Rhode Island. My family's very loving. Dad's a doctor, lots of resources, plenty of love. But when I got into high school, what had been maybe 10-15% of the time rose to about 65-75% of the time. And I was really pretty horribly depressed in high school, which is typical for people with bipolar disorder, for there to be kind of a spike during adolescence. In any case, my parents, magical thinkers, thought perhaps if they moved me somewhere else that the depression might stay behind. And so I went and spent my senior year in high school in Paris, France. And as it turns out, Paris is kind of an antidepressant. And I found that that actually depression had sort of stayed behind. I really enjoyed my friends there. I had a lot of freedom. I had these very international young friends there. It was completely different than my high school, which had felt very cliquey and turfy. And I really was pretty happy. In December of that year, I got into college early, and it should have been really one of the happiest times of my life. But instead, afterwards, about 24 hours later, I started to become horrifically depressed again. And I went home for the holidays and, really couldn't do much more than weep, worry, and sleep for several days. And because the external sort of facts of my life were so out of whack with what was going on for me internally, my parents were ready to accept that there might be a problem. And they took me to see a psychiatrist who promptly misdiagnosed me with depression and put me on some medication that ultimately had a pretty horrible